The over-the-counter killers, tackling the threat from rising levels of addiction to prescription drugs, and the men-only cancers that could be prevented if half the population talked more about their health. I'm Martin Stanford. This is Insight. Welcome to Insight. We have a problem with drugs, and not just illegal drugs. The latest medicines prescribed by doctors to treat extreme pain or anxiety or depression are very effective at relieving symptoms, but they come with a serious and problematic side effect. Almost all of them are opioids, and like their close chemical relative heroin, are extremely addictive. The United Nations Office on Drugs and Crime has taken doctors to task, recommending they stop over-prescribing strong psychoactive medications. Insight's Emma Birchley reports.
Legitimate drugs, initially prescribed by a doctor, some to ease pain, others to reduce anxiety or aid sleep. But the key is knowing when to stop. The result for too many is a lifetime of addiction, and the problem is growing.
We're not more depressed than we were 10 years ago. I don't think we're in more pain than we were 10 years ago. Nobody's actually come up with the answer as to why prescriptions for a painkiller like tramadol, for instance, have gone up 400 or 500%.
But the drugs not only have the potential to be highly addictive, they can also be incredibly dangerous. Michael Jackson's death was caused by an anaesthetic given to help him sleep, while Prince had been taking the powerful painkiller fentanyl before he died. And it was a deadly mixture of prescription drugs which killed actor Heath Ledger. In fact, 43% of drug deaths in the United States were due to prescription opioid drugs in 2010, and the problem is spreading.
Unfortunately, we've exported our problems to the world. We're seeing problems in, mostly the westernized countries, but we're also hearing of pockets of problems in less developed nations, in places like Africa and even South America. All across the world, I think people look to the technology of prescription medications to solve a lot of their problems, and unfortunately, it kind of can create the perfect storm for a global epidemic.
In England alone, the number of prescriptions for opiate painkillers rose from around 3 million in 1991 to 23 million by 2014. And deaths involving two such drugs, tramadol and codeine, increased by 39% in England and Wales between 2011 and 2015, while the number of people killed after taking the sedative diazepam rose by 41%. Usually the drugs are only intended for short-term use. But those who want them are finding ways of getting them, whether to treat the symptoms of depression, pain or anxiety, or simply to escape reality. And in many cases, they're being given the drugs by friends and family who think they're actually helping. The opiate codeine is even available over the counter with bold warnings of the risk of addiction. And there's also the internet. Online pharmacies are required by law to receive a valid prescription, but sites like this are under investigation for allegedly selling the drugs without one.
You're paying quadruple the price sometimes. Are you actually getting the actual drug that you're actually paying for? Is it legal? Is it UK registered? Has it been tested by the UK government? Is it a legit drug? That's the main concerns.
Harry Shapiro, who runs an online drug information service, believes part of the prevalence could be down to the perception people have of taking such drugs.
Opiate painkiller use is almost the more acceptable face of addiction these days, whereas a lot of people feel that they've been getting these pills from a doctor, so therefore they must be okay. They must be doing okay. They're not going out on the street and buying heroin.
Part of the issue in Europe is understanding the sheer scale of the problem. In the United States, systems are in place to record information, and there's much more funding for research. Here, the data just doesn't exist. One rare study recently carried out, involving 5 European countries, revealed that nearly 1 in 5 people in Spain will abuse prescription painkillers across their lifetimes, 1 in 7 in Britain. But coming off the drugs can be far from easy. And once they're ready to seek treatment, the only option is often alongside crack or heroin addicts.
The patients who find themselves dependent often struggle to actually achieve abstinence. With opioid painkillers, it's often sort of stomach cramps, nausea, vomiting, and intense craving for more drug use. With sleeping tablets such as benzodiazepines, it's much more about it's much more of sweating, of twitchiness, which can often lead to fits, seizures, and there's a mortality rate, a death rate associated with that. So they're very serious and require medical supervision.
So much of the drug dependency is hidden from sight, but no one doubts the abuse of prescription medication is reaching epidemic levels across the Western world and shows no signs of slowing. Emma Birchley reporting for Insight.
Well, let's discuss that further. I'm joined by Joanna Moncrieff, a practicing psychiatrist and reader at University College in London. The extent of the problem, as we heard, is hidden. Does that chime with you? We don't quite know just how many people are in this case, in these circumstances.
Well, different countries produce different data, and in the UK what we know is how many prescriptions are issued. It's quite difficult to find out how many people are getting those prescriptions, but we do know that prescriptions for a range of psychoactive medications, including antidepressants, have been going up considerably over the last 20 years or so.
And does that chime, do you think, with the instance of genuine complaints, or is the accusation that doctors are just being lazy and sending patients away with a mild problem with some antidepressants just to get them out of the surgery?
I think the problem is that there's been an expectation has been produced in people that there'll be a pill to solve lots of different problems,
right,
and that if they feel sad or distressed, they've been told that that might be a medical problem and they should go and see their doctor. And I think that message has been taken too much to heart by people and has caused this problem. The message was deliberately created back in the 1990s by the pharmaceutical industry in order to sell antidepressants. They set about marketing the idea that unhappiness is a disease called depression that can be treated by antidepressants, and that it's caused by a chemical imbalance. Whereas actually, we don't, and that message was not based on good evidence,
wasn't based on
findings.
good science, was it?
No, it wasn't.
No, okay. So people actually, although life can deal you a hammer blow, a death in the family, some other problem you might have to deal with, a relationship breakup, whatever it is, there are non-medical interventions that can be used to get through that phase in life.
Well, we know that there are things that are helpful for depression, you know, however you define depression, that are not to do with drug treatment, including exercise, for example.
Yeah. So just taking a pill is not the solution, and we are now reaping the problems of pills being oversubscribed. Now you've got patients in this predicament, for that is there, because in a sense it's not their fault. They started on a program recommended by their doctor and they're stuck on it. Is it difficult for doctors to tell patients you really must stop using these drugs now?
I think it's really difficult, and I think it's difficult for patients to stop, and I think this is a big part of the problem, that people get started on the drugs and then they think that it's the drugs that solve the problem and they become very anxious about stopping. So a lot of these drugs can cause physiological withdrawal symptoms, and that can be difficult for people. But I think a bigger problem is people's fear about stopping. People become psychologically dependent on taking the medication.
Well, and those fears are disproportionate, are they? They're out of all kilter with what actually is involved.
It's probably the case for many people that they could manage their problems without the drug treatment, but they become fearful that they won't be able to. And one of the problems with taking a drug to deal with lots of everyday problems is that people lose confidence in their own abilities to deal with those problems.
How do you rebuild that confidence? Is it possible to do that?
Well, trying to help people to come off medication is multifaceted, and you need to help them in many different ways. And part of the help needs to be information and guidance and support about withdrawal symptoms, physical withdrawal symptoms. But part of the help needs to be about how to address stresses and problems in their lives in other ways, whether that be taking exercise, mindfulness, meditation, trying to deal with the problems at the source, trying to deal with the root of the stress.
Do you think as a group of people then, generations are becoming less resilient to the stumbling blocks of life?
There may be some truth in that, but I also think that modern life is quite hard and quite challenging for people, and there are lots of potential sources of stress and anxiety. A lot more is expected of us now than it was 50 years ago, of most people. And so I think there's a lot more pressure on people, and that can drive people to, to feel that they might need a medication to help them get by.
But I was going to allude to the idea of education here, that, do we need to prepare people for the fact, at the moment, okay, you might feel pretty good, life's fantastic, but you will have difficult times or challenging times, and you don't need to resort to popping pills to solve them.
Absolutely. I think we've got to undo the damage that was done by this huge marketing of this idea that depression is a disease, that it's caused by a chemical imbalance, and that you need a drug treatment. Yeah.
That said,
and we need to pull back from that, and as you say, encourage people to find other ways to deal with problems and see them as a inevitable part of life.
But that said, we shouldn't decry a brief course of treatment, say for a month or so, to get somebody over a hurdle, which then they stop using the drug. That can be very effective, can't it, for patients?
In some circumstances, but I think it's very important that we are honest and upfront with patients about what the drugs are doing. And I think it's very important that we are not telling people that they are correcting a chemical imbalance. Yeah. We need to tell people that these drugs are psychoactive drugs which will change the brain and make them feel different. And I agree that in some situations that might be helpful for people, but people need to be aware that that's what they're doing when they take these drugs.
Would you dramatise that choice then, but by inviting doctor and patient to have the conversation whereby we could go down this route, but these are the consequences of it, and maybe there are other strategies you'd like to choose instead?
Absolutely, absolutely. I think consultations should be much more about, well, I'm sure many already are, but about setting out different options for dealing with the problems and going through the pros and cons in detail, and particularly the side effects, both short-term but also long-term, of getting onto the treadmill of taking prescription drugs.
And because they, once on, they might stay on them for months, if not years, if not decades. And that creates all sorts of other medical problems further down the track. So although budgets are tight, I appreciate that, and medical provisions all around the world are under strict budgetary controls, if you can reduce the expenditure later, it certainly seems a step worth taking now.
Absolutely, and the evidence is, especially with antidepressants, that people do get stuck on them for years. Yeah. The intention may have been originally to prescribe them for a few months, but for the reasons we were talking about earlier, partly that people start, get very fearful about stopping, they do end up taking them for a long time.
Well, good to talk to you. Thank you for being with us. Joanna Moncrieff, thanks for being with us today.
Thank you very much.
This is Insight. Coming up, male cancers take more lives than female ones. Are men too shy or too reluctant to report a problem?